Welcome to another edition of Health Department Roundtable. I'm Chris Schultz, your host and chair of the Board of Health. And with me tonight is Marty Golightly, our health director, our public nurse Lindsay Wright, and our resident microbiologist, Tom Boulay. Thank you everyone for joining us. First question is, what are our current numbers in Abington and the state of Massachusetts looking like?
88 currently active in town, a little over 488,000 in the state. And I think we reported a little over 3,000. I'd have to double check that in the number last night. So I have not seen tonight's numbers, but that's where we're at in town. 88 active. That's a far cry from 160, not but 10 days ago.
Yeah, I think we haven't seen the 80 since just before Christmas, if I'm not mistaken.
You'd be right. Yeah. Around, maybe the first week of December and then earlier in November.
So excellent. It might be the coldest day of the year, but we got good news to warm our hearts. So
another good news. Can I segue into the clinic on Monday?
Yes, please.
So first off, everybody, I'm sorry that the clinic fills up so fast. I mean, as you can imagine, interest is off the charts for the people that want to get the vaccine. So it's a focused 75 and older clinic happening at the Council on Aging on Monday. Please, no walk up. It's pre-registered, everybody. If you've been told that you have an appointment, then you have an appointment. Come in. We'll start vaccinating at 10. We'll be done around 3. We were only allotted 100 shots, so we can only do what we're allotted. We were able to open up 50 more today. We got 50 more vaccines. We're doing 150 people at the senior center on Monday, and we're very proud of that. And that's after Wednesday clinic where we did about, I think it was 117 total, Lindsay, that's right, yeah?
117 was our final number.
117 on Wednesday. And for context, the state did 100 in Fenway today, so.
And just for those who know, are kind of following along, we say scheduling, it's multiples of 10 because of how the vials are drawn up. Some vials have 11, and so that's how we ended up with 117. Not a single dose in Abington has been wasted. And we will continue that trend if Marty and I have anything to say about it, which we do.
And we do, and we will.
And we do.
Not waste a single dose.
We will not waste. There's no concern about waste in Abington.
No, we have enough interest. So yeah. So Monday, senior center, and I know there's a lot of concern about future clinics. I will just say this: it is not us. Abington is one of the best prepared towns in the area, and I can say that with confidence. And we had a lot of guests come to our Wednesday EDS, which is an emergency dispensing site, which is what we activated at the high school to do our phase 1 responders. And the response to that was tremendous. And we were able to do all of the 117. A lot of other towns sent their representatives to come and check it out, to come see how we were doing. And I've gotten a lot of good feedback from a lot of the people that do this kind of thing for a living. And we were proud of our clinic on Wednesday, and hopefully we can carry that momentum into the Monday Senior Center's Council on Aging clinic.
Yeah, I believe we heard from the FEMA deputy that he was impressed with what you have going on here. So great work.
I mean, of all of the people to not be bad at this in front of, he's got to be one of them, right? So I'm glad that he was pleased. It means a lot to us that he would, say that he thinks we did a good job. I mean, because those are the experts. Those are when another subject matter expert tells you that you are doing a good job, it feels good and it offers some vindication. But that's not going to stop us from trying to get better every time we do this. We want to streamline the process, and we want to make sure that we are perfecting it as we move forward. And with the elderly population, I want to assure our residents that safety is going to be our #1 priority. We'll have a designated safety officer. We'll have people in the parking lot, walking around and making sure it is as safe as we can make it, because we are anticipating a weather event, we'll call it, on Monday.
It wouldn't be New England without snow on the big event.
It can be easy, right? So we will do our best to, and we're as of right now, we're not canceling it. It's go. This is New England. The snow didn't bother us anyway, right?
It's just par for the course.
Yeah.
And I want to remind people that when future clinics are scheduled, we will be getting the word out via Constant Contact and various social media. So.
Yep. And we do have a running list at the senior center and at our office, and we're going to try to break it up. And so the senior center will call some people, in our office will call some people to get the next group of 75 and olders on the appointment schedule as soon as we have them available. But again, I can't schedule any new clinics if I don't have vaccine.
Yep.
So what we got is what we do.
I don't know anybody in the world that wants to stick you in the arm more than Marty and Lindsay do. So rest assured, Abington, as soon as the doses are available, we'll be getting them up.
We're not sitting on them.
Nope. So on that note, as we're discussing vaccines, I think a lot of people have questions on exactly what is this vaccine and what does it do and how does it work. So Tom has been nice enough to join us to kind of give us a breakdown of what we're putting in our arms. So
thank you very much. Yeah, so my name is Tom Boulay. I am a doctor of biology, molecular biologist by training. I am not a medical doctor, right? So you may have questions about your personal situation vis-a-vis the vaccine. You should take those to your primary care physician, your nursing staff. I'm in no position to answer those things. I can tell you how the vaccine works. Also, I guess as a matter of because where information comes from matters, I feel like I should disclose that I'm not an employee of Moderna or Pfizer or anybody that makes vaccines. What I have here is I've assembled on my own based on research and scientific journals, but nobody provided me this information, right? So you should know where your information comes from. I guess for right now, it comes from me. But I don't have any conflicts of interest necessarily to state.
Can I interject real quick, Tom?
Sure.
So I asked Tom to come on to do this because one, he's a friend of mine, and two, because it is important for us in the health department to know that the residents are having as much informed consent as we can get them. It is important for us for the town to realize that we are not just willfully ignoring any science or otherwise. We are making sure that our residents are as informed as humanly possible. And this was the genesis of that idea. And I really want to say thanks, Tom, for doing this. I know this is volunteer work. This is bottom of his nice guy heart coming to Abington to help me make sure that our residents know everything they can know about the vaccine. Thanks, Tom.
My pleasure.
Thank you. You were a huge help on Wednesday. I know the staff appreciated it. I know that we had a couple of the patients have questions that you were able to answer for us. So thank you.
And I will be at other events too. I'm happy to answer questions as we go, right? So don't be shy. If you have any questions, I'm sure you can reach out to Marty and Lindsay, and they will get the questions filtered into me or see you at one of the clinics. And so I'm going to share some slides. Not too many. We're not going to make this super duper dry. And so I want to talk a little bit about what this virus is and what the vaccine does and what we're trying to accomplish. So there's a cartoon version on the right here of COVID-19, right? So it's a virus that in the interior, it's got, I think I can even do a laser pointer. In the inside, right, it's got some genetic material, which is basically instructions for making more virus, right? It gets in the cells and makes more virus. And this is the stuff that it has as its instruction set, right? And on the outside, it's got basically an envelope, right? So it's just how it stays safe as it travels from cell to cell in your body. And then on the outside of that are these little sort of green looking flower things, right? And these are called, or they've been named the spike protein, right? So these are actually the mechanism that the virus uses to get into your cells. You can think about these as this is what interacts sort of with the docking stations in your cells, and this is how it gains entry. And these spike proteins are super important for the virus, but they're also super important for your immune system, right? So one of the things that we know, or we came to learn from studying viruses like this, is that when people that get an infection build up an immune response, what they're actually doing is their immune system's learning to recognize this spike protein, right? And so when the immune system of the person who's been infected sort of gets around to realizing the spike protein's there, and it gets to decide that, anytime it comes across anything with this spike protein to sort of eat it up and get rid of it, that's when the patient's immune system can clear the virus, right? So what the vaccine is really trying to do is get this spike protein into your body, right? Not get the virus, but just get the spike protein. So it teaches your immune system what to recognize, right? so that if in the future you do get exposed to COVID-19, to coronavirus, that you have a plan, right? Your body has seen the spike protein. It knows what to go after. It knows to clear out of the way anything that has this attached, right? So really, the vaccination is all about the spike protein. If we can get your body to recognize it, you will clear it faster, right? You'll clear it a number of days faster. And in this particular virus, that makes a whole world of difference, right? If you have a couple of days head start on this particular, clearing this particular, recognizing this particular protein, you're going to survive, right? If you don't have the head start, that's where we start to get into trouble. So again, the vaccine is really all about this spike protein. That's what we're trying to make sure your immune system can recognize. So,
Tom, one of the
yes.
frequent questions that we get is, does the vaccine contain any of the actual coronavirus?
It does not. So the vaccine is really, it's sort of a new method of making a vaccine, and we'll talk about that in a minute, but it doesn't contain any of the virus at all.
Thanks.
Right, so understanding that this spike protein is important, and we need to sort of expose you to it, right? And exposing you to the spike protein is what builds your immune response, right? Historically, there's a couple ways that vaccines do this, or that science develops these vaccines to sort of expose you to things like this. The first is, you could try and grow a lot of the spike protein in test tubes, right? So there are ways that science has sort of developed to grow a lot of the spike protein, and then you could purify it, and then you could expose patients to that. You give them a shot of the spike protein, and your immune system could develop a response there. Unfortunately, it takes a really long time to sort of get that technology up and running, right? So this is a situation where we needed a vaccine right away, and so it really wasn't a great option. A slightly faster option is that you could take something like the spike protein and you put it on a different virus, right? Another virus that's not quite as deadly. That won't grow as fast, it won't kill your cells as fast, but you'd still have the spike protein on the outside, and your body would still develop an immune response. And this is actually what you see in like the Johnson & Johnson vaccines and the AstraZeneca Oxford University vaccines. What they've done is they've taken the spike protein and they actually put it on the common cold virus, or a version of the common cold virus. And then they give you that. And so your body is good at fighting off the cold virus, and they get exposed, your body gets exposed to the spike protein, and you develop an immune response. It's sort of a tried and true method, but also, not as fast to develop and deploy, right? So which is why you're starting to see some of the trial results on those vaccines come out now, right? So we had two tried and true methods, but unfortunately, they're kind of slow to get off the ground. And so these two new vaccines, right, from Moderna and Pfizer, are different in that they're not sort of giving you the spike protein, right? We're not growing the spike protein in a tube and giving it to you. What they're actually giving you is the instructions to make the spike protein, and your body's actually what makes it. So in effect, your body acts as the test tube in this case. You're going to inject the instructions to make the spike protein, right? Your body's going to make the spike protein for a couple of days, and then your body's going to clear everything away. But you have then a couple of days of the spike protein, and that's really enough for your immune system to recognize what it is and build up a response, right? And it turns out it's a technology that's much, much faster to develop and much faster to deploy, which is why the two vaccines that we have available to us now that are approved by the FDA are this kind of vaccine. It's just a lot faster to develop. It's a lot simpler in a lot of ways. It's a lot safer, right? You don't have, you're not dealing with people handling, a modified version of the common cold. You're not dealing with some of these other things. It's actually a much, much simpler version, a much, much simpler vaccine to make. The next question I get, and I get this question a lot, right? And it's a great question, is how did this vaccine get developed so quickly, right? So and it's understandable. Like, we had a pandemic, and frankly, within a couple of months, we had a vaccine. And did they have to cut any corners? Like, how did they know what to do? Is there any risk here? And the truth is, we had a couple of things going for us in developing a vaccine like this. The first was the SARS virus, right? So if you remember the SARS virus, there was an outbreak that was mostly contained to mainland China in the early 2000s. And it turns out that that virus is a cousin of COVID-19, right? So they're both coronaviruses. They both use the spike protein on the outside, right? They both use the same docking station on cells to get in. And so there's 20 years of research there, sort of understanding how that virus works and understanding the importance of the spike protein and understanding that, it's sort of the primary target for your immune system, right? So it gave people that sort of went to work on this, right, a great first target. It was a huge leg up in kind of understanding what to do and what kind of strategy to put in place. The second thing is that, the virus is, we talked about it, it's the instructions for making the spike protein. And those instructions come in a molecule called RNA. RNA is a molecule that your body makes all the time. It is a cousin to DNA, right? So it's basically, and Lindsay used this phrase and I love it, it's like the Snapchat version of your DNA. Like it exists for a little while and has a function and then it disappears. Your body is actually super good at recycling and digesting RNA when it's done. You have a vast sort of recycling system in your body for turning over RNA and getting rid of it. Now, RNA technology is actually not very new. Like it's been known for a long time. There's research going back to injecting into animals and showing a response in the early 90s. There are several FDA-approved drugs that are RNA based, and I think there's 9 approved by the FDA now. There's dozens more in development. And the great thing about RNA is it's really easy and fast to produce at scale. Right? You can make a lot of this in a short amount of time. You don't have these complicated manufacturing issues that you have with making the spike protein or making these modified viruses. Right? So, RNA technology has come a long way. We knew how to work with it fast to ramp up. Now, delivering it, right, is sort of a challenge. And so then we get to sort of the third piece, which is, the way that it's delivered in this case is that the RNA is sort of wrapped up in these really specific sort of fat bubbles. They have these sort of really cleverly engineered mixes of fats, and they force the RNA in liquid into these bubbles of a very specific size, called liposomes. And then when they get injected in the body, it'll sort of take them up, and that's how they get in. Again, this is sort of technology has been, it's been around for a little while, and it's constantly getting better. The first example of this sort of for human use is a chemotherapy drug that came out in 1995 called Doxil. It was one of the first real advances for ovarian cancer. But there are another number of other drugs that use the same methodology, right? So you can sort of wrap up what you're trying to deliver to cells in sort of a layer of fat. And that makes it a lot easier to sort of get it to where it's supposed to be and get it into the cells where you want it to be effective. So really what you had here was kind of a 3 good things working for us. We sort of knew where to go from SARS. We had something that we could produce at scale. And then we had a way to sort of get it into where it needed to be. And then I guess the other thing is that, the idea of putting RNA inside of these fat bubbles in case of pandemic has been the break glass in case of emergency plan going back a while, right? So I could find evidence in scientific journals of this idea going back as far as 2012, right? So you start to see in some of the literature like, hey, if we ever come across a pandemic, one good way to sort of develop a quick vaccine would be get the RNA of the thing that you want to develop an immune response to, put them inside these liposomes, put them in the body. There we go. So, yes, the vaccine was developed very quickly, right? But we had a lot of pieces going for this. And there was this idea that had been floating around for a long, long time that this would be a good way to go. So now the next question I get a lot, right, is the vaccines are really effective, but what does that actually mean, right? So what you see on the screen is basically the money slide from the presentation from Pfizer to the FDA, right? This is a representation of two different groups. So the Pfizer vaccine was tried in, I think there was nearly 15,000 people got a placebo. So they got salt water as an injection. And there were 15,000 people that got the vaccine as an injection. And what they did was they basically counted by day how many people were newly diagnosed with COVID, right? So you see over time, right? If you go left to right, is you're going to go day by day. And the red line represents the people that didn't get the vaccine, right? They got the placebo. And what you can see is that, from day one, you pretty much don't go a day without more people coming down with COVID, right? The placebo has really no impact. It doesn't slow down, doesn't prevent anybody from getting COVID. They don't fight it off if you've given them a placebo. The blue line is the vaccine, right? You get to a point where, there's a dramatic slowdown in the number of people every day in that group that came down with COVID-19, right? And so when they talk about 90% effective, it's really kind of the ratio from the people that didn't get the vaccine to the people that did get the vaccine, right? How many of those people were able to fight off COVID? Now, there's a couple of other interesting pieces here, right? The first is that these two lines way down here on the bottom left pretty much overlap for a while, right? So, even after getting an injection of the vaccine, patients go, 10, 11 days, 12 days, it's a little hard to see exactly, before these sort of lines diverge. And sort of the thinking here is that what this means is that basically your body needs 10, 11, 12 days to sort of react to this new vaccine, right? And build up the immune system, right? So if you get the vaccination, you're not immune on day one, right? It's going to take your body a couple of days to really kind of build up the antibodies, build up the immune response before you're in a much better position to fight off COVID, right? So that's sort of the takeaway here is that it takes 10, 11 days after the vaccination before you're in better shape, right? I think the second important point is you see these days for people who got the vaccine but still got COVID, right? So the vaccination is not a guarantee that you won't get COVID. You still can get exposed. You can still get COVID. You can still be a carrier, right? So if you can develop COVID, you can be somebody that gives it to somebody else, right? So this is reason why, even after you have the vaccine, even if after you've made it 10, 11, 12 days after your vaccination, the best practices like wearing masks and trying to not touch your face and wash your hands and all those other good stuff they've been telling us for the last 11 months, like those are still things we have to do until we have enough people vaccinated that we don't have to worry about giving it to somebody that hasn't had the vaccination yet, right? The last thing, and it's not quite on the slide, is that, there are this population here that got the vaccination and developed COVID. But one of the things you'll see in the data is that none of these, or actually one person came down with a severe case of COVID, right? And it was only, in my mind, sort of the technically severe case. Their blood oxygen sort of dropped below, I think, 93%, right? But they didn't even feel bad enough to go to the hospital, right? So they made the technical definition of severe COVID, but they didn't feel bad, right? So unlike, the group in red that got the placebo, there are a number of patients there that came down with severe COVID, a number of patients that got hospitalizations. So I guess one way to think about the vaccine is that what the vaccine is doing is, it might not be 100% protection against COVID, but really what it's doing is it's preventing the COVID from getting too bad. You're giving your body that couple of day head start on building up an immune response. And that's the difference between getting sort of a mild flu-like version of COVID and having a really, really bad case of COVID, right? So the vaccine's cutting off the potential of the virus, right? And that's really kind of one of the most important aspects of it. You take it from something that could kill you down to something that's, a flu potentially.
Also, doesn't this severely impact the healthcare delivery system? So like when the patients aren't getting this sick because they've been vaccinated, they don't need to go to the hospital for when they do get sick. So this shrinks that population and allows for the people that are really sick to get as much care as they possibly need, because we don't have, wards of people in the hospitals who we could have prevented, right? So it just kind of helps decompress our healthcare delivery systems as well.
Absolutely. I mean, there are all kinds of stories, and I can't cite them right now. I'm sure we've all heard them of something happens right now, and you maybe in a prior life would have been taken to the hospital, but there's no beds, right? If you increase the vaccination here and you take the people out of the hospital or prevent them from going to the hospital with severe COVID, people that need the hospital at that moment, there's a bed for them at that point. I have just 2 more slides. The next question that I get from friends and family is, the vaccine going to make me sick? And the answer,
everyone asks that. That's everyone's biggest concern is, right, how are we going to feel?
So I would say that there's 2 ways to look at this, right? There's sort of the long-term view and the short-term view, right? Long-term, right now, there's no evidence that the vaccine will have any long-term impact on you, right? There's no evidence to suggest that you have this vaccine and you will have some kind of effect from it later in life. Compare that to, there's actually a lot of evidence emerging that even if you have a mild case of COVID, you might have effects for the rest of your life, right? You might have lung damage, you might have brain damage, you might have heart damage, even if you have a mild case of COVID, right? So, looking at what is emerging, personally, I'd say for myself, it sort of suggests that there's a lot more upside to taking the vaccine and a lot more downside to sort of not taking the vaccine and risking long-term health impacts from COVID. So that's sort of the long-term view. And more evidence will come out about this over time, as we study people that had COVID, and as we study the people with the vaccine, right? So it's sort of a question to be answered, and we can only answer it with time. But right now, it's sort of pointing towards there being much worse outcomes from getting the virus than from getting the vaccine. The second way to look at this is short term, right? So is the vaccine going to make me sick in the next 2 days, next 2 or 3 days? And the answer is maybe a little bit. So it is an intramuscular injection in your arm, right? So 83% of people reported that their arm hurt, right? That's probably going to happen. You're going to be sore, right? There's some redness in the area has been reported, not a ton. Some swelling occasionally does happen. Some swollen lymph nodes, right? And that's good news, right? Because that's your immune system working. So just from the shot itself, there might be some side effects. In terms of sort of more systemic things, right? There are some reports. So the percentages here are after first dose and after second dose. And then these are the Moderna numbers. So 1% of people reported fever after the first dose, 17% after the second dose. And this is within 7 days of the shot. Headaches, not terribly uncommon. Fatigue, not terribly uncommon, right? 2 in 3 people after the second dose reported fatigue. Muscle aches, a little bit. Joint pain, yep, definitely a little bit, about a 20% first shot, almost half the second shot. A little bit of nausea, a little bit of chills, right? So it's sort of a mild, not a great flu day, right? For a lot of people, the day after the shot. I wouldn't plan to run any marathons the day after the shot. It's a good day to catch up on some Netflix and then, move on. Some other things that people ask about. Anaphylaxis, right? Am I going to get the shot and go into some kind of shock? In the data that Moderna and Pfizer reported to the FDA, I didn't see any reports of anaphylactic shock, right? I know from the vaccine clinics that they are well prepared if anything should happen, but there's almost no evidence that anything will. Did anyone die of any weird reasons from getting the vaccine, right? It's always something they study. And the answer seems to be no, right? So there were, the vaccine population that they tested, there are a number of people that had comorbid conditions already. They had bad hearts or they had, pulmonary issues. There were some people that died, but it was basically the same number of people that died from getting the placebo shot as getting the vaccine shot. right? I think the unfortunate reality here is this was just kind of a sick population. It doesn't look like the vaccine is causing any deaths. If that makes sense. At least not, there's no evidence or statistical evidence that that's the case. There were a couple of things where, again, I'm not a medical professional, but you might want to have a conversation with your physician if either of these two cases apply to you. So one of the things that Moderna noted in their filing to the FDA was that any patients that had a cosmetic filler injection, right? So had injection to their lips to make them bigger, or had a cosmetic filler as part of like breast reconstruction surgery after breast cancer. The people who had cosmetic filler injections tended to have a stronger injection site reaction, right? Some of the lipids in the filler are similar enough to the fat bubbles that surround the vaccine or that make up the vaccine that their immune response may be recognizing that as a problem, right? Again, nothing like anaphylaxis or anything that's severe, but they did note that some of the patients that had this background of having cosmetic filler injections did have a more pronounced injection site reaction. So that might be something to consider and have a conversation with your physician about. And then unfortunately, pregnancy, there's very conflicting data here, right? So typically what happens in a clinical trial, and it's no different here, is that they don't really allow, generally, pregnant women to participate in the clinical trial. There's just too many variables and they don't want to risk the health of the unborn baby. In fact, anybody that reported becoming pregnant between the first injection and the second injection, they took out of the study, and they follow those patients and those children for a very long time, right? Now, so there's not a lot of data there. They sort of purposely didn't test this on pregnant women for sort of obvious reasons. Now, when the FDA came out and gave their guidance, they didn't specifically say, this is not something that you shouldn't, or this is something you shouldn't give to pregnant women. They didn't contraindicate the vaccine for women that were pregnant. They didn't really provide any guidance. I think on Thursday of this week, the World Health Organization, which is not the FDA, came out and said they think this is a really bad idea for pregnant women, right? So unless you're in a circumstance where you are very, very likely to be exposed to the virus, it's sort of their position that you shouldn't be giving the vaccine to pregnant women. It's sort of, as far as I can tell, still unsettled, right? So if this is a situation that applies to you, I can only recommend that you have a conversation with your physicians and make a plan, right? So, but just know there's a lot of ambiguity here, right? There's a lot still up in the air.
Just to touch on the anaphylaxis at our clinics, we are staffed with no less than 5 or 6 nurses and no less than 7 or 8 EMTs with an ambulance on standby. So in the very, very unlikely event that would happen, you would have medical care within less than a minute at our on-site shot clinics.
If there was such a thing as overprepared, you would be overprepared. But for somebody like me, I'm all about being overprepared. The last topic, right, that sort of has got a lot of news lately is virus variants. So what does that mean? So virus variants are mutations off the original coronavirus. The good news is that all of the Moderna vaccine and the Pfizer vaccine deliver some protection so far against all variants, right? So there are some viral strains where it seems like the vaccine doesn't work quite as well, but it still does have some effectiveness, right? There are, as of today, 4 variants, right? So there's the UK variant, the South Africa variant, which seems to be getting the most press, I guess, the Brazil variant, and there's also a Denmark variant, right? All of these things are mutations of the coronavirus, but they're all mutations in that spike protein, right? That flower on the outside, and they change it. They change the spike protein to a slightly different shape, and that sort of it throws off your immune system a little bit, right? It doesn't quite know what to do with this because it's not really kind of what it trained for, at least not entirely. So the good news is, right? Like I said, there's no variant yet that completely escapes the vaccination. There's some that are slightly Some of the vaccines are slightly less effective, but they're still at least partially effective. I guess two things are important on this. Variants are less likely to emerge when there are less people that have the virus, right? So the act of getting the vaccination will slow down the emergence of new variants, right? New variants only emerge when people get infected. So the less people that get infected, the more we're going to slow down the emergence of new variants. The other good thing is, we talked at the beginning about how it's actually, they have a mechanism now to develop new vaccines, right? Moderna is already working on a booster variant for this variant, or some of the variants, which is basically that they change up the RNA instructions for your body to sort of match these new variants. And so they're working on a booster, right? But we know that they can develop these things super fast, right? They've kind of established that they can develop them really quickly. They can get them into testing really quickly. They've sort of proved already that this mechanism is safe, right? And so, I think that if some of these variants become a problem, we effectively already have a plan, right? We know how to deal with this. We can develop a booster vaccine that sort of mirrors that same mutation or whatever emerging mutation is, and that could be a booster shot. And then there we are. We might wind up in a bit of a cycle here where we end up chasing this virus for a little bit, but the virus can't sort of escape forever, right? At some point, the virus will run out of possible mutations, or make a mutation at the same time that makes it less effective. And so that's kind of when we're moving towards. So it is possible, like I said, that we'll end up with a series of booster shots in the future, but it's not in my mind a situation where we've got to wait another 9 or 10 months to have another effective vaccine. It's something that I feel like they can develop fairly quickly and get out to the public, hopefully fairly quickly.
Hey, Tom,
Sir.
I want to say thanks again for doing this. I know Tom as a good friend and a passionate science communicator. So again, he volunteered out of the kindness of his heart, and me calling in a few favors. Let's just be honest. And he will be a volunteer at all of our shot clinics, or at least the vast majority of them. So if you want to come and say hi and ask him any of these type of questions, the man lives for this. He's extraordinarily good at it, and I'm proud that he was able to volunteer with us. And so thanks again, buddy.
My pleasure. Thanks for having me.
Yeah, thank you, Tom. We now know more about the virus, and remember, knowing is half the battle.
Informed consent is important for us. So this is why we ask people to come on and do these things. And so we want to, if anything looks like it's a secret, then we don't have trust, and we don't have people's faith that we're doing the right thing, and we're doing our absolute best to do the right thing. And so without people like Tom to be able to communicate it to us effectively, then we're always going to be behind. So thanks, Tom. Again, dude, thank you very, very much for that. I know a lot of people will get a lot out of that, and it means a lot to us that you were willing to do that.
My pleasure.
Yes, thank you.
Thank you.
And for our viewers, if you have any questions, please make sure to reach out to either the health department or myself through the Abington Town website or the Abington Board of Health Facebook page. We'll be happy to address them at our next episode of the Health Department Roundtable. So Marty, Lindsay, Tom, thank you very much for joining us tonight.
Thank you. Can I quickly add one thing? I know Marty touched on it earlier. Monday's clinic is full. We want everyone who wants to be vaccinated, but please, if you don't have a confirmed appointment, call us. We will put you on the list. We don't want anyone hanging out outside waiting for a vaccine. We really want this. We want people to only come with an appointment.
Please.
Yes. All right. Thank you, everybody. Everyone be safe. In the meantime, remember to wear your mask, wash your hands, and be careful out there.